Hello, my name is Dr. Leslie Haller. I am a general dentist who specializes in releasing tongue ties in infants, toddlers, children, and adults. I would like to talk about what chiropractors need to know about tongue ties. Tongue ties are not always easy to diagnose. They can be thick, thin, attach at the tip of the tongue, all the way at the base, or anywhere in between. The one thing they all have in common is that they anchor the tongue too tightly to the floor of the mouth. The diagnosis is made based on symptoms in combination with exam, history, and appearance. This diagram shows all of the different areas where the base of the tongue attaches to the rest of the body. If the attachment is too tight in any particular place, it can pull the head forward or the back of the neck down. Depending on which attachment or attachments are too tight, symptoms can be difficulty swallowing, in infants, the inability to latch and suckle, impaired speech, poor posture, chronic neck and shoulder pain, migraines, TMJ pain, obstructive sleep apnea, and more. One of the tongue attachments is to the hyoid bone. The tongue is the most powerful muscle in the body. Every time a person with a tongue tie swallows, the hyoid bone is pulled forward. No wonder they end up with a forward head posture that won't stay back, no matter how many times you adjust it. They may be spending hours at the computer, but it could also be a tongue tie. Another area of attachment of the tongue is to the jaw, neck, and shoulder muscles. Constant pulling on these areas every time a person swallows can lead to migraine headaches, TMJ and face pain, or upper back and shoulder pain. People with tongue ties can have difficulty keeping their tongues out of their airways when lying down. This causes a serious, life-threatening condition called sleep apnea. They also tend to be mouth breathers and snore. They may even be using a CPAP machine or dental sleep appliance for sleep apnea. Frequently after a tongue tie release, sleep apnea is greatly reduced or even eliminated. Wouldn't your patients call you a hero if they didn't have to use their CPAP machine anymore? Tongue ties are not something chiropractors usually think to look for, but they are much more common than you think. Whenever you see a patient with possible symptoms of a tongue tie that just don't seem to stay corrected even after repeated adjustments, you might consider a tongue tie consult. I frequently see patients who have seen everyone with no significant relief. Almost immediately after releasing the tongue tie, they can move their head more easily, breathe and swallow better and easier, and chronic pain goes away. So if your patients have chronic neck and shoulder pain, poor posture with a forward head position, chronic headaches, jaw and TMJ pain, mouth breathe, snore, grind their teeth at night, or have sleep apnea, and have limited head and neck range of motion that just won't go away even if you correct it over and over and over, think about referring them for a tongue tie consult.